will the healthcare district pay for the state mandated retrofits and or building replacements? Coming up, Tracy.
Well, I'm not going to take much time on this one. I've kind of been trying to figure that out. I know that that there's some programs of support and providing support, but I know that this is something that the healthcare district board's been struggling with. And I know that this can be a struggle from my years on the school board as well, because all of our institutions and buildings in Alameda, it's a great place to live and it's a historic place to live, but as we all know, a lot of these buildings, the hospital is 100 years old, these buildings have been around for many years, and the state has passed laws over the past 30 years or so to require seismic upgrading, but they haven't, and having worked in government for my whole career, this is often the case, they don't provide the money to do what you're required to do. So I think this is going to be a big challenge. I think the new services and the new revenue are going to provide some support and some funding for this. And I know that Michael have really, they probably have made some real strong moves in that direction. But I think if I'm on the board, I certainly would be working closely with my colleagues, working with Congresswoman Lee's office and working with the state, definitely the state offices and the state legislature, to see if we can get some more time, although I suspect that that's not possible just from what the things that I've reviewed about this issue. So.
Yeah, Tracy's right about one of the biggest challenges in the next several years comes down to what's happening today. It doesn't help us to look too far down into the future. We're looking for an extension on our retrofit program, which will cost about $16 million in 2020. And it looks pretty likely that we will be able to get it. What does that give us? The question is not so much that, it is how do you sustain a healthcare district. One of the things we've done is to try to, we're on the path to do that by these initiatives I keep referring to, we're looking to increase from 61 million in net revenue to 71, which should include a so-called profit to us. That makes us look good to a potential partner. It also gives us a potential opportunity to fund part of it ourselves. I would look towards bonding as a last result. I don't want to go into a private situation such as St. Rose was forced into. They couldn't make payroll. We're trying to make money so that we look like a more viable partner. It's going to change, but I want to keep the emergency room open. So with that viewpoint, we need to find a funding source, either in partnership through a bond position or get ourselves so far into the black that we can actually go out and get our own bond. It'd be nice perhaps to go with the city and get past that. But ultimately, it's not real to think that small institutions will be around as they are today by the year 2030. That's the reality. There's too many Kaisers, too many centers in the world.